Good day, folks. Alfie Vente here once again at Vente Pain Relief Clinic. I'm just going to adjust the camera here. And I have another one of my health tips. Today we are going to talk about posture and what exactly is good posture. What does that exactly mean? Because it gets bandied about by therapists. We have a general idea of what it is, but this is something that I think you can use to help you in regards to determining if you have good posture or not. All right, or proper posture. So we have Skelly here, my buddy Skelly. Okay, so if you notice, I've taped up a number of areas here. You'll see like in black tape. These are areas which should be in alignment. So if you were to hang a string from the ceiling, what should happen is that this string should basically follow this line down the side of the person's body. Okay, so let me just turn it this way for a second so you can see. All right. Okay, so I'm going to just move them over this way a little bit. So you'll see, starting from the head. Okay, you see that there's a black piece of tape here. This is the external auditory meatus, ear hole. We'll call it the ear hole. So if you have that string that drops down from the ceiling, it should be in line with the center of the ear hole, right? As you drop down, this ear hole should be in alignment with the tips of your shoulder. You see this black tape here, okay? So we got the center of the ear hole, the tips of the shoulder, and then as we move further down, I'm just gonna move Skelly over this way, you'll see that right on the center of that bony protrusion there, the hip, that's another area where it should be aligned. So again, if you drew that string, like he's got, Skelly pretty much has almost perfect posture, as you can see here. So you draw down the little, that string, and it should go to through the center of the person's hip here. Okay, and I'm just going to tilt the camera downwards so that you guys can see. As you can see, that line, there's black tape on the side of the person's knee, right on the center of the side of the outside of the knee there. And then further down, you'll see on the ankle, the tip of the ankle there, the center of the tip of the outside of the ankle or the lateral side of the ankle, there's another piece of tape. Okay, so this is what proper alignment should be, proper posture. This is what it should look like, right? So again, the ear hole, the center of the ear hole should be in line with the tips of the shoulder, should be in line with the center of the bony protrusion of your hip. We go down a little further, the center of the outside of the knee, the lateral side of the knee, and then you go down to the outside of the ankle there, you see that, that piece of tape right on the center of the outside of the ankle. So basically that's proper alignment. That's what proper alignment should be. If you take a look at yourself in the mirror, maybe what you could try doing is maybe if you've got a partner, set up like a plumb line, draw that string down all the way down to the floor and stand right beside it and see how your posture is in neutral to see if you actually have proper posture. And the reason why you want proper posture is so that it basically decreases the amount of tension in certain areas such as the neck, the mid-back, the lower back if you're in potentially a proper position. If you've got any questions, feel free to give us a call at 416-644-8894 or email us at admin@ventepainrelief.ca. Please like, share, and follow our page. We really appreciate it. I want to thank you in advance. And remember, our premieres for our health tips are every Monday at 5:30 p.m. Eastern. Have yourself a great day, and we shall see you next week. Take care.